Hey everybody, welcome back to another reaction video. Today we're going to be checking out another non-sports reaction video. We're going to be talking about and watching healthcare in Germany. I'm not the most knowledgeable person on healthcare. I wish, of course, it was cheaper in America. I know over in Europe that it's popular for having pretty good healthcare. So Germany, I guess, is the example for today. We're going to be checking it out. I'll have the original link in the description. Shout out to the creator of this video. Hope you guys enjoy. Please make sure to subscribe to my channel. Help me get to 7,000 subscribers. It would greatly appreciate it. Hey, let's get into this video. So I know a lot of countries in Europe just have free healthcare, I guess.
System we covered, Singapore, got a great response from all of you. This week we head back to Europe. Specifically, we're going to Germany. Their universal healthcare system is based on the principles of Bismarck, which say that the state should provide only for those unable to provide for themselves. It's a private insurance system, and it's the topic of this week's healthcare triage.
Let me pause this quick. I just want to say first, I'm not going to comment much over this video. I like to give my thoughts more at the end, okay? So I may say a couple of things throughout this video, but try to keep my comments more for the end. Anyway, let's get back to it.
Health insurance is mandatory in Germany. Everyone has to get it. Before 2009, some of the richest people in Germany could choose not to buy insurance, but that's no longer the case. Insurance is sold only by non-profit private companies. There are more than 130 of them, and they're also known as sickness funds. There's statutory health insurance, or SHI, or voluntary private health insurance, or PHI. PHI covers some of the benefits that SHI doesn't, but most are minor. It also gets you access to some better amenities and covers some
which does make sense. Well, actually, wait, hold up.
86% of Germans are covered by SHI and 11% by PHI.
So usually, if you have the money,
universal systems, the insurance is pretty comprehensive.
I'd assume.
Coverage includes preventive services, hospitalizations, outpatient visits, prescription drugs, mental health, dental care, eye care, rehab, hospice care, physical therapy, even sick leave is covered. Long-term care is covered by a different insurance, but that's mandatory too. There are limits to this though, and some people buy supplemental private long-term care insurance. Any employed citizens and pensioners who make less than 52,200 euros a year and their dependents are covered by SHI. Anyone who makes more than that or who is self-employed can choose to get the SHI or buy PHI.
So I think that's pretty smart.
The SHI path. There used to be no co-pays for SHI, but some were added in 2004. They were about 10 euros for a doctor's visit. But in 2013, most of those were removed again. There are still co-pays, 5 to 10 euros for prescriptions, but lots of drugs are still free, 10 euros a day for hospitalizations, and 5 to 10 euros for medical aids. Deductibles can vary by plan. There's no cost sharing at all for kids, and a cap on out-of-pocket payments at 2% of household income. That number is 1% if you have a chronic illness. Out-of-pocket spending accounts for just over 13% of all healthcare spending in Germany, making it slightly less than Canada, comparable to the US, but much more than France. About 72% of healthcare spending is public spending, and just over 57% comes from SHI. Employees or pensioners pay an 8.2% tax on their wages up to 47,250 euros. Wages above that are exempt from the tax. Employers contribute an additional 7.3% tax. The contributions are all put together and then spread out amongst the nonprofit SHI funds. If a fund runs low on money, it can charge the members a bit extra. In 2011, 13 of the 156 funds did so, to the tune of about 100 to 180 euros a year. PHIs are considered private health spending. There were 42 of them in 2011. Slightly more than half of them are for profit. The other
if you have the money,
half are non-profit.
Go for them.
The premiums are risk-based on entry into the program, meaning that older and sicker people pay more. Employers make contributions to PHI as they do for SHI, but the employee contribution is higher. PHI is still tightly regulated by the government to protect consumers though. Laws also encourage competition between the funds. Doctors belong to regional associations, which negotiate contracts with
I'm curious what the salaries for healthcare workers are.
Docs work in private practice for the most part, with 60% in solo practices, 25% in dual practices, and the rest in group practices. Mid-level practitioners, like physician assistants, are also employed in most offices. About half of physicians in SHI programs are family docs, and about half are specialists. Patients can choose any primary care physician, specialist, or hospital that they like. There's no real gatekeeping mandate, meaning that people can go to see specialists without first getting the permission of their primary care doctor. Although some funds do offer them, and offer incentives for using those gatekeeping functions. A relatively small number of people do, though. Most docs work in a fee-for-service way based on negotiated rates. There are preset maximum numbers of patients per practice, as well as reimbursement points per patient. This means that there are limits on the number of patients and number of treatments for which a doc can be paid each year. If a doctor goes over, they may not be paid. About half of all hospital beds are in nonprofit public hospitals. An additional third are in private nonprofit hands.
For-profit?
For-profit. And that percentage...
I'm curious how many for-profit are in America.
Salary doctors who don't...
I don't know, opening like a business.
The Federal Joint Committee decides what to cover and how to define quality. The Institute for Applied Quality Improvement and Research in Healthcare is responsible for quality assurance. Hospitals are mandated to report on 27 indicators so that they can be publicly compared. The country tries to control costs in a number of ways. There are a number of voluntary insurance schemes to do better disease management. Germany uses reference pricing with respect to drugs to try to get citizens to choose cheaper options. Basically, that means that the insurance will pay the amount of a cheapest drug in a class, and if patients want a more expensive one, they have to pay the difference themselves. A lot of research goes into deciding which drugs are most cost-effective. Finally, regional budgets are used to hold down spending. For instance, if a doctor goes over what's expected for prescriptions for their patients, they are held financially liable. In 2011, Germany spent $4,495 per capita on healthcare, or about 11.3% of GDP. That puts it on par with France. It's expensive, except for the US, which is insane at $8,508 per capita and 17.7% of GDP. But unlike some other countries, Germans have great access. More than 3/4 of Germans are able to get same-day or next-day appointments with their doctor, putting them at or near the top of the developed world. Quality is generally good. Life expectancy at birth is 81 years, making them 24th in the world. That's behind Singapore at 84, Canada at 82.5, and France at 82.3, but ahead of the UK
America's the lowest.
and the US at 79.8.
79.8 is still not too low.
If not all of those countries. Germany has an above average number of physicians and nurses. They have a below average number of CT and MRI scanners. Their preventable mortality rates are well below OECD average. A 2012 study found that Germany outperforms the United States and sometimes the UK in preventing death. It loses to France though. Downsides? Because doctors are spread out so much, there can be gaps in knowledge about what patients have and what's been done. Surprisingly for Germans, it's somewhat inefficient. The fee-for-service model encourages more care, which some think goes too far. And some doctors hate the system, which can penalize them for doing too much. Germans worry that differences in physician salaries may lead to a primary care shortage in the future. Self-employed people also pay a lot for care since they're responsible both for the employer and employee contribution. Finally, some claim that systems that employ tiers of coverage, specifically the SHI and the PHI, often lead to the wealthy doing much better than the not wealthy. But it's worth noting that the vast majority of people choose the SHI option. What keeps the public and the private option so close in terms of quality, costs, and benefits? Likely it's the German government, and there's a lot to be said for it.
Alrighty, now time to give my opinions. Like I said, I'm not the most knowledgeable on healthcare, especially healthcare in other countries. I just know that a lot of people say it's better. Now, like I said, I don't know too much to explain why it's better. Well, we just watched the video, so let's talk about that. Anyway, so America, yes, the healthcare in America is pretty expensive, and depending on your situations, you know, it could be even worse. I'm pretty sure every single one is private. I mean, obviously, like if you don't make enough, you do get help from the government. But I just know it's not the best. Obviously, there's been complaints about it. It's one of the worst in probably the world, out of the more developed countries. Now, another problem though, or plain devil's advocate, is, well, maybe just America has too many people compared to other countries like in Europe that have great healthcare, like Sweden, Switzerland, Germany. I mean, America has over 300 million people compared to other countries who have less than 100 million population. So I don't know, that's always like a case too. You could argue. I'm not here to say which one's right or wrong. Another thing I feel like is, well, a big problem in America with healthcare is like becoming a doctor is so expensive. Like you want to become a doctor, you're going to be over $100,000 in debt. And even though, yeah, you can make that back in a year's salary, it's hard for somebody in the moment to be trying to scrape up money and try to get through medical school, paying for rent, paying for the books, paying for food. That's the hard part, and that's what makes a lot of students drop out and turn away from the medical field. So I wish they made medical school cheaper. Healthcare, of course, cheaper, but I don't know. I really don't know. This is definitely interesting though. I like the setup of the German healthcare. I thought it was pretty interesting. Hope you guys found it interesting too. Let me know what you guys think down below. Recommend more videos. I'm out, guys. Peace.